Namaskar, I Jitendra Sharma. On behalf Guru KPO welcomes you. Today my topic is silent killer. It means hypertension. Hypertension is a condition in which blood pressure of our body is less than 120 by 80 mm of Sc. It is two types. It is defined two types: systolic blood pressure and diastolic blood pressure. Then a condition that systolic blood pressure is more than 120 mm of Sc, then condition is called systolic pressure. And then blood pressure is defined 80 mm of Sc, then condition is called diastolic blood pressure. Basically it is two types now, hypertension and hypotension. Hypertension means blood pressure is more than 120 by 80 mm of Sc. Then a condition is normal, then blood pressure is less than 120 by 80 mm of Sc, then condition is called hypotension. But in hypertension we include in silent killer because it is defined two types. It has many precipitating factors. It has many etiological factors. Now following that, blood pressure is defined. It is classified in two types. First is primary hypertension. Second is secondary hypertension. Hypertension is classified in two types. First is primary hypertension. Second is secondary hypertension. Approximately 90% of cases are suffer from primary hypertension, and 10% cases are suffering from secondary hypertension. The etiological factor of primary hypertension is family history, prolonged mental illnesses, stress, and autometabolic disturbances. Now, secondary etiological factors are that endocrine disturbances, renal disease, heart disease. In endocrine disturbances like that, one hormone is suppressed by another hormones. That is negative feedback mechanism. And one hormone is not suppressed by another hormone, but it is assisted in another hormones. That is positive feedback mechanism. During the time of uterine contractions, a hormone is assisted in another hormones. That is positive feedback mechanism. But in negative feedback mechanism, one hormone is suppressed by another hormones, like growth hormone is suppressed by growth hormone releasing inhibitory hormone. That is etiological factors of hypertension. But in another cases, there are many etiological factors are precipitate our hypertension. Like main etiological factor is obesity, stress, sedentary lifestyle, alcohol. That is our various types of hypertensive etiological factors. But we discuss our diagnosis. What are the diagnoses of hypertension? First of all, we can say that a measurement of hypertension reading is then 120 by 80 mm of Sg. That is normal blood pressure. But blood pressure is more than 120 by 80 mm of Sg. That means it is suffering from hypertension. That is a measurement, a diagnosis of hypertension. But in another cases, there are another diagnosis of hypertension like renal disease cases. Now diagnosis, that is it is measurement by the sphygmomanometer. If reading is 120 by 80, then normal blood pressure. And the normal blood pressure is more than 120 by 80 mm of Sg, that is hypertension. But in serum electrolyte imbalances, the reading is very, very high, that is hypertension. Now clinical features, it is asymptomatic. Asymptomatic means absence of symptoms, so it is called silent killer. But fatigue, malaise, dizziness, blurring vision, tinnitus, and hematuria. Hematuria is a condition that urine with blood that occur in the hypertension. Now management. There are various types of management of hypertension. First of all, we discuss on about medical management. Medical management means drug therapy like beta blockers, calcium channels, captopril, methyl dopamine tablets are given in hypertension. Now, there is no need of surgical management, but there is need of nursing management and dietary management. In dietary management, we provide sodium restricted diet and cut sodium restricted diet, and spicy foods, junk foods, and fatty foods avoided. But in nursing management is a vital important part in the hypertension, because without nursing management, without nursing care, a patient is not treated well. But in the nursing management, there are some diagnoses are created. Now first is knowledge deficit related to disease conditions, because persons has not a lot of knowledge about disease, its clinical features, its etiological factors, and its treatment. So our aim is to provide a various part of health education to the patient. Now last is general care. General care is the most important treatment of the patient, because without general awareness, patient is not perform a well conditions. In general cares, lifestyle modifications, because hypertension is disease with lifestyle, so lifestyle changes is also occur in these conditions. Lose weight, smoking, avoid alcohol, and get regular exercise per 3 days. And the most treatment of hypertension is that fewest drugs to lowest dose while encouraging the patient to alter lifestyle. For more details, log on www.gurukapio.com.